Let's briefly talk about epidemiology of Lyme disease. Lyme disease is endemic in many regions. It is a major global public health problem. It is particularly predominant in Europe, in North America, as well as in parts of Asia, particularly in Russia, China, and Japan. The reservoir host of the causative agents of Lyme disease includes small mammals, especially white-legged mice, birds, as well as deer. Deer plays an important role when it comes to tick reproduction. Lyme disease exhibits a seasonal variation with higher incidences in the period between late spring and early autumn. And this period basically coincides with peak nymphal tick activity. Lyme disease usually undergoes underreporting, and this underreporting is usually due to the non-specificity of the symptoms and the diagnostic challenges that affect Lyme disease. Let's talk about risk factors. Certain individuals are basically more prone to developing Lyme disease, and these individuals include people that live or work in wooded, in bushy, as well as in grassy areas, forest workers, farmers, hunters, as well as campers, hikers, and outdoor sports enthusiasts are more likely or more prone to developing Lyme disease. Also, individuals that don't wear protective clothing or don't use tick repellent in endemic regions are easily susceptible as well to getting Lyme disease. Also, failure or delayed removal of tick attached to the skin is also a predisposing factor. Age as well is a predisposing factor, is a risk factor, as there are higher incidences in children as well as in middle-aged adults. But let's talk about the diagnosis of Lyme disease. The diagnosis of Lyme disease involves combination of clinical evaluation, epidemiological exposure, as well as laboratory investigation. In terms of clinical evaluation, the presence of erythema migrans is a diagnostic feature of early localized Lyme disease. It's a very important diagnostic feature, and also the presence of attached tick to the skin is also a diagnostic feature. Some symptoms associated with early staged or early localized Lyme disease include fever, include malaise, headache, myalgia, which is muscle pain, as well as arthralgia, which is joint pain. Other diagnostic features include, or other diagnostic approach include serological tests. In the laboratory, serological tests usually involve two-step testing. The first of which is the use of ELISA, and or IFA. The first serological approach is the use of ELISA or IFA. ELISA is the enzyme-linked immunosorbent assay, and the IFA is the immunofluorescence assay. This is the first serological approach when it comes to diagnosing Lyme disease. The second is the confirmatory Western blot. For the serological methods of diagnosing Lyme disease have a major limitation because antibodies may not develop in early stage of infection, and this may lead to false negative results. Polymerase chain reaction and as well as other molecular techniques are also used to detect Borrelia DNA that is present, and the samples particularly used include the cerebrospinal fluid and the synovial fluid. There is limited sensitivity when blood samples are utilized. Culture can also be used, but it is rarely used because of the fastidious growth requirements of Borrelia species, as well as the long incubation time of Borrelia species. Let's talk about prevention and control. Prevention and control of Lyme disease include wearing of protective clothing, more especially wearing long sleeves. Also, the use of tick repellent in endemic regions is also very pivotal. Performing thorough tick checks after engaging in outdoor activities and prompt removal of any tick seen on skin. Clearing of tall grasses and little bushes around houses and residential quarters also plays an important role. Management of deer population in endemic regions is also very essential. Health education, as well as organizing surveillance programs, also helps in serving as a preventive strategy and control strategy of Lyme disease. Let's talk about treatment. The treatment of Lyme disease, or Lyme disease rather, is effectively treated, especially when the treatment is initiated early. For early localized Lyme disease, oral doxycycline is usually used. Doxycycline, doxycycline. Oral doxycycline is usually used for treating early localized Lyme disease, and the period of therapy usually ranges from 10 to 21 days. Alternatively, amoxicillin, amoxicillin as well as cefuroxime is used. Alternatively, amoxicillin and cefuroxime are usually used, and they are usually used for children as well as pregnant women. Neurological and cardiac involvement usually require the use of intravenous ceftriaxone. Ceftriaxone. Neurological involvement as well as cardiac involvement usually require the use of intravenous ceftriaxone.